Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 60-year-old patient presents to the office for a routine eye exam. The patient reports no pain or noticeable vision changes, but has a family history of glaucoma. On exam, the intraocular pressure is elevated, but the optic nerve appears mildly cupped with no signs of acute distress. Which type of glaucoma is this most likely? Is it A, closed angle glaucoma, B, open angle glaucoma, C, acute angle closure glaucoma, or D, ocular hypertension? Take a moment and tell me what you got in the comments, you guys. All right. So y'all know I always tell y'all to read the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So the stem of the question here states, which type of glaucoma is this most likely, right? All right. So let's see what we have going on, right? Because technically we're trying to come up with the diagnosis. So I always tell you, if they're asking you for a diagnosis, you need to run it back and look at the assessment findings, right? All right. So here, this is a 60-year-old patient. They come in, they're just here for a routine eye exam. The patient reports no pain. They don't have any vision changes, but they do have a family history of glaucoma. On the exam, the intraocular pressure is elevated, so we know that's an issue. But the optic nerve is mildly cut, but there's no signs of acute distress, right? So when we think about glaucoma, I always tell y'all to think about your open angle and your angle closure glaucoma, right? And so with open angle, which this is the answer B, open angle, I say think that the eyes are still open, right? Brittany's brilliance. The eyes are still open, but we are noticing changes. The classic presentation with glaucoma is that increased intraocular pressure. Um, but their vision is still, and this is the most common type, right? But they still have vision in place because their eyes are still open. Whereas with angle closure, closed angle, it can be said either way. With that, I say the eyes are closing, they're going blind. This is something that we would approach differently. And I'll get down that path. I like to build on material as you're studying. But to explain this person came in, they don't have any symptoms, right? They're asymptomatic. They do have a family history. The intraocular pressure is elevated. There is mild cupping noted. And so we're able to say, yes, this is glaucoma. It is open angle, right? So B is your best answer. Question number 2. A 50-year-old patient presents to your office with severe sudden onset eye pain, blurred vision, headache, nausea, and vomiting. On exam, the pupil is mildly dilated and non-reactive. And then, I'm sorry, I paused because I said mildly, but it's mid-dilated. But let me start back over because I'm jacking this question up for y'all. A 50-year-old patient presents to your office with severe sudden onset eye pain, blurred vision, headache, nausea, and vomiting. On exam, the pupil is mid-dilated and non-reactive to light, and the cornea appears hazy. What is the most likely diagnosis? Is it A, open angle glaucoma, B, acute angle closure glaucoma, C, retinal detachment, or D, chronic dry eye syndrome? Take a moment and tell me what you got, you guys. All right, so similar question here states, what is the most likely diagnosis? Again, I always say, if they're asking you for the diagnosis, you need to run it back and look at those assessment findings. So we have a 50-year-old patient. They come in, they're having severe, sudden eye pain, right? Blurred vision, headache, nausea, vomiting, the works. On exam, the pupil is mid-dilated, is non-reactive to light, and the cornea appears hazy. Now, y'all, even if you don't know anything else, with your baseline medical judgment, we know something is not right, right? Something's wrong here, right? And they're coming in here, and one of those key things also is it's sudden. They're not having that gradual vision loss. With open angle, you know how I told you, like in that scenario that we just had on question number 1, they they were asymptomatic. And then it was noted. Well, in some cases, they will have symptoms, but it's typically gradual vision loss. Like they're starting to notice that there are some changes, and that may have warranted the eye exam, where then you note the increased intraocular pressure being elevated, right? Whereas with angle closure or closed angle, it can sometimes it's written both ways. But I just said this. They're going blind. The eyes are closing. Think about it like that, right? It's sudden. This is emergent. We're not waiting. We're not slowly seeing things change, gradually change. They're in here because they are concerned, because they're having this, hey, I was fine, and now suddenly my vision has changed. It's real blurry. It's hazy. They may complain of the eye pain. They may have associated symptoms like this patient with the headache and the nausea and vomiting. But the exam also confirms this, right? And so the best answer here is B, acute angle closure glaucoma. All righty. Question number 3. A 55-year-old patient presents with sudden severe eye pain, blurred vision, headache, nausea, and vomiting. On exam, the patient's eyes appear red and the cornea is hazy. The pupil is fixed and dilated. The intraocular pressure is significantly elevated. Based on these findings, what is the next most appropriate step in management for the suspected closed angle glaucoma? Is it A, you want to initiate topical beta blockers and schedule follow-up in 1 to 2 weeks? B, refer for emergent ophthalmic, y'all. And I tell y'all, I do this for y'all, because I will put things on here so that you are prepared for boards. And I know I'm going to butcher these words. So, referral for emergent ophthalmology evaluation, but it says ophthalmologic, but I don't know why that makes me so tongue-tied. Whatever. C, perform further evaluation to confirm the diagnosis. Or D, prescribe systemic corticosteroids for inflammation. What do y'all think? What do y'all think of this one? All right, so stem of the question. Based on these findings, what is the next most appropriate step in management for the suspected closed angle glaucoma? All right, so we already talked about this, right? I was just going over this in the last one. Their eyes are closing. It's closed angle. They're going blind. It is emergent. You want to refer them out for emergent ophthalmologic evaluation, right? Now, A says initiate topical beta blockers. No, that's for your open angle. You can do the timolol drops to help for our open angle glaucoma. But for closed, remember, the eyes are closing. They are going blind quickly. We do not want the eyes to close. Refer, refer, refer. Okay? All right, you guys. As always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, y'all feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. All of the things that I do offer are linked in the bio of this channel, including the website. But as always, if you're looking to book any of my one-on-one sessions or customize our personal plans, I always say either call, text, or email so that I can speak with you guys to gauge what you truly need to make sure you're booking the appropriate session types, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.